Good morning, everyone. So today I want to have a chat with you about ethical dentistry and non-ethical dentistry or unethical dentistry. And it's something you will hear a lot from other dentists or other owners that you probably be working for if a new graduate. So first, for credibility, my name is Khaled. I have been a dentist for 20 years. I own my own dental practice, Lakeside Dental Spa, and I've been running my practice for the last 14 years. I took it from 1 chair to 10 chairs and from 3 staff members into 40 staff members over the course of 14 years. So I'll give you some examples. So you might work in a practice, and in that practice you might practice the type of dentistry where you see patients coming for checkups and cleans. They have large amalgam fillings. They can see the small mesial crack lines or palatal crack lines or distal crack lines, and you decide to monitor those fillings, for example. If the owner is under the impression that those teeth can cause problems to the patient and they need to be discussed and managed, and the amalgams need to be removed and the cracks need to be managed and followed up till the end, and then a ceramic option is given to the patient or a full cusp coverage to the patient. If you practice type dentistry where you monitor them, you could be looked at as you're providing unethical dentistry because you're not providing your patient with the right treatment options. The opposite way around, if you're a dentist who routinely will manage those cracks and remove the amalgams and follow those cracks, and you work for an owner who believes that they need to be monitored, they can look at you and say you're practicing unethical dentistry. Is one of them is more right than the other? It's very subjective, and it will be different from one dentist to another. For example, dental implants, ceramic, titanium implants, all-on-4, removing all the teeth, doing alveolectomy, removing a lot of alveolar bone, a lot of soft tissue, and then placing 4 implants versus 6 to 8 implants and to preserve as much alveolar bone and try to build all the sockets and build some nice pontic areas and try to preserve the gum structure for the patient as much as possible. Again, someone who practices routinely will consider an all-on-4 dentist is unethical. Someone who practices all-on-4 might consider that over-servicing, over-treating the patient and putting them through a lengthy period of treatment as well. So another example would be orthodontics, extraction versus non-extraction, expansion versus extraction premolars to gain space to relieve crowding. Early orthodontic treatment, myofunctional therapy or myobrace or anything to correct the tongue posture and the cheek and the lips movements for patients when they're growing could be considered unethical when some orthodontists look into it, and the opposite way around. Those who practice this routinely could consider delayed treatment and extraction orthodontics is also unethical. Tongue and lip ties for babies, TMJ and orthodontic treatments. That orthodontic treatment does not fix TMJ and might not even improve the TMJ problems. So being called ethical or unethical is very subjective. So what do you do? I want you to understand, number one, if you're a new graduate or starting your career in dentistry is not an exact science. There are certain things that everyone will agree is ethical or unethical. For example, a molar with a forcation involvement and class 3 mobility, probably necrotic, every dentist will say it requires extraction. If one dentist say, no, we can treat that, we can do a root canal treatment and a crown and greater mobility is going to fail, that's unethical. That's a clear cut. But many things in dentistry are very subjective from one clinician to another. You can present the same treatment plan to 10 dentists and you might get 10 different plans. And not just that, some of the 10 different plans will be a little bit different than the other ones and will cause the other plan a little bit over treating or under treating. So my advice to you is, if you join a practice and you have enough trust in the abilities of the practice owner, try to follow their treatment philosophy if it has been successful. Then slowly you will start to take more courses, more CPD, and you can challenge the thought process and try your own way of doing dentistry or different approach of doing dentistry. As you progress in your career, you will find more preference of what will work best in your hands, what will work best in your skill set, and it doesn't mean it's ethical or unethical, as long as within the umbrella of evidence-based dentistry, I think you'll be okay. But you need to understand there will be different opinions, there will be controversial treatment options, and as you progress in your career, you will find ways to maneuver that and work through that, and hopefully you will have a very fruitful career and you will enjoy doing dentistry. If you find this information helpful, please make sure you like and share it to your friends and colleagues. Please make sure you subscribe to my channel and turn notification on so I can notify you when I release more videos. Thank you so much for listening. It means a lot to me.